Hey, good afternoon. This is Dr. Bill Bird, Chief Medical Officer at CGH Medical Center. Hey, thanks for joining me on Facebook Live today. What is it, 20th of May? So, the plan for the day is I'm going to give you a fairly short local COVID update. And then when I get done with that, we're going to go to a field trip or two that I did during this week that I wanted to highlight some stuff at CGH in our respiratory therapy department. So we'll get to that shortly. But for now, let me start the COVID update. And I think this is going to be a really nice positive update in terms of the information that we have locally. So here's some of that information. For the past 20 days here at CGH, we test folks who come into the emergency department or patients who are in ready care. For 20 days, the number of positive results that have come back have been in single digits, which is really good because we've been much, much, much higher than that during the surges that we've had. So that's really encouraging. The number of patients that are hospitalized with COVID are decreasing, which is encouraging. We gave out just CGH, this doesn't include the health department or retail pharmacies. We gave out 915 vaccines this week. We've started to do a vaccine walk-in clinic at our main clinic on the second floor. We have signage for that if you're interested in doing that, and strongly encourage you to do that. We have both J&J, which is the single shot vaccine, as well as Moderna there right now. So if you're interested, take advantage of that. It's every weekday on the second floor of the main clinic. And I think it runs like 8:30 to 4:30, kind of in that range there. Yesterday, we had 46 people take the opportunity to get vaccinated at that clinic. That's in addition to the mass vaccination clinics that we are still doing. So yeah, I want everyone to know about that. Our county numbers are looking really good. Matt's going to put that up right now. Thanks, Matt. So you see on the top left there, Whiteside County positivity rate, we actually are lower than the rest of the state, which is really encouraging, really nice. You see the number of cases we had reported on May 19th was 3. So yeah, in Whiteside County, I am encouraged. You can see that on the right there, that trend graph going back to looks to me like last November. And you can see where we're at now, and that's good stuff. Now, as far as Illinois vaccines, so we have given in Illinois, as of yesterday, 10.5 million vaccines. Our rural counties are not quite as high in terms of vaccination percentage as suburban or urban counties. So I think there's definitely still opportunity here in Whiteside County, as we obviously are more rural, to get more vaccines to folks. And that's a good thing. And now, of course, it's 12 plus, particularly when there's Pfizer available for those 12-year-old and plus folks. So that's really encouraging. I guess my take home here on this. Before I get to the take home, I also wanted just to say that vaccine, in terms of concerns about the vaccinations, I think it's understandable that there are concerns because these vaccines are relatively new. But boy, all evidence so far shows them to be very effective and very safe. And at least in our country, I think we're at like 200 million vaccines have been given. So, right now, what I saw for anaphylaxis with the mRNA, like the Moderna and Pfizer, we're talking 1 in a million for anaphylactic reactions. And not everyone who dies who has that kind of reaction, but it's still 1 in a million. And there's this very, very small risk there. I look at that, though, and you take a look at, I was just plugging in, what's your risk of dying in a car accident? Well, actually, a lifetime risk. What I was looking at was 1 in 608. So yeah, there's a risk with the vaccines, but all things considered, they work really well, even with the variant so far, and they're really safe. So anyhow, good stuff. Take home. I'm gonna have Matt put up this graphic here. And we've been showing this most weeks. And it's our homemade graphic, but essentially natural immunity is people who've had an infection with COVID. Vaccinations are people who develop antibodies because of the vaccine. That's the way to get to herd immunity or close to herd immunity. And below are the variants, which can, as time goes on, they can be more infectious than the original COVID was. And then our behavior impacts that as well. But right now, at least, the arrow definitely is pointing towards the natural immunity and vaccination. And I look at this that yes, natural immunity is playing a part because more and more people have had COVID. But right now, I think the vast majority of our, thanks Matt for showing that graph. Right now, the movement that we're seeing in a positive direction is in large part related to more and more people who are getting vaccinated. And then as a result of that, they're not going to get sick, or they're at least not going to get really sick, and they're not going to spread it nearly as easily. So yay, vaccine. It's doing what it's supposed to do. Okay, well, hey, thanks for listening to our local COVID update. That's kind of where we're at right now with things. What I am going to show you next, actually what Matt's going to put up on the screen in just a moment here, is I had an opportunity this week to go to a couple places that our respiratory therapists are involved with. And those two places were, number one, our pulmonary function testing lab, where we check and test folks to see if they have COPD or if they have asthma, and if so, how they might respond to treatment for those conditions. And it's the machine we use at that facility is kind of cool, so you might want to take a look at that field trip. And then I did a field trip to pulmonary rehab, so it's rehab for people who have lung issues, and spent some time there. And that field trip I thought was a lot of fun, and I think you'll get some more information, good information about how that works here at our hospital. So thanks for watching my part of this. I encourage you to stay with us and watch these field trips. And until next week, take care. Okay, well, hey, welcome to our field trip of our pulmonary function testing area. And like my new fuzzy little microphone, this is pretty cool, I think. Don't you think so?
Yes.
Oh, yeah. How about that? Yeah. So anyhow, I have a couple folks going to help with that. First of all, I have Ashley. And Ashley, you may recognize Ashley from this part up. I've had her on our Facebook Live before. Hi, Ashley.
Hi, Dr. Bird.
Ashley, you oversee the pulmonary function testing area, right?
Yeah.
Okay, tell me a little bit about it.
So, yeah, this is our pulmonary function lab. This is where patients can come in as an outpatient and get some testing on their lungs done. It's just a couple breathing exercises, and we can determine whether or not you have COPD or asthma based off of that test.
Okay. All right, yeah, so we're a part of the hospital people don't even realize is here, but we do these every day of the week, other than we don't probably do Saturday, Sunday or anything.
No, Monday through Friday.
All right, all right. Hey.
Hi, Dr. Bird.
Hey, so I think I know you. This is Ginger. Hi, Ginger.
Hi, Dr. Bird.
So Ginger, when I walk by this area of the hospital all the time, and Ashley's office is right over here, but Ginger, all the time I'm seeing her going in and out of this. I think you kind of run this show here, don't you?
I do all of the testing.
Okay.
For the most part.
Okay,
yes.
All right. So we have a content expert here that's going to kind of take us into this pulmonary function testing area. So I'm actually going to let Ashley just chill out and relax and enjoy the rest of the show. And Ginger, it's you and me.
Sounds good.
Okay, so let's open the door and see what we can find in here. Ooh, okay. So I'm just going to start asking you, Ginger, about some stuff that we have in here. I think we'll start with, what's that big booth there?
That is the machine where the testing is done.
Okay, all right. Now, for a typical patient that comes in here and is going to have this pulmonary function test due, I'm assuming they're going to be sitting in that machine.
Yes.
What else are they going to do in here?
Well, first off, they're going to get weighed.
Okay. We're not going to do that for me, but okay,
No,
yeah.
no.
All right.
And they'll sit down and we go through a series of questions about their history,
Okay.
like smoking history,
Okay.
their list of medications,
Okay.
and so forth.
All right.
And then we start the test.
Okay. One of the things I know we've had to deal with during the pandemic is, I think early on, I don't know if we even did testing in here because we weren't, because of the aerosolization of the virus and stuff like that. So what's the status of, is this room set up any differently now, or do we do anything differently because of the pandemic stuff?
Not right now.
Okay.
But we are converting the room into a negative pressure room.
Okay. So like in terms of patients and how we do this with patients, we must have a little bit of a break between patients and those type of things?
Yes, we're leaving we're seeing half the amount of patients. We're leaving at least an hour in between the patients for air in the room to turn over.
Yeah, so that's all kind of the CDC stuff that we're doing just to make sure people are safe when they do this. And then ultimately we're going to have this room what's called negative pressure, which is that, like, let's say there's a little thing over here on the window and it just pulls and sucks the air out of it.
Correct.
Which then allows us probably to be able to do this even more frequently in terms of how many of these tests we can do, right?
Correct. We'll be able to do a test every hour.
All right. Okay. All right. So we're doing what we need to do to take good care of people, and but it does probably keep you from doing as many tests as we normally have done in the past.
That's correct.
Yeah. So short of weighing me, let's just kind of have me go through this, Ginger. Pretend like I'm a patient. What would you have me do next? I've weighed.
So I would have you sit down in a booth.
Okay, I'm going to give you this. You can even hold it yourself. How about that? All right. Okay, so I'm going to sit down in here. All right.
And then in this computer, I would enter all of your information, your name, your age, your sex, your height, and your weight.
Okay.
Then I'll ask you a series of questions. For example, levels of shortness of breath.
Okay.
So if you're short of breath with no activity at all, or with basic activity or severe activity,
all right.
I'll ask you if you cough sputum up from time to time, or if you have persistent coughing.
Yep.
I'll also ask you if you wheeze, and if you do, how often. Then once all of that information is entered into the computer, I'll go ahead and start explaining the test more.
Okay.
That it's a bunch of breathing maneuvers, and I'm going to explain each breathing maneuver before you do it, and I'll coach you through while you're doing the breathing maneuvers, and that you do them over and over again.
Okay.
Because we're looking for repeatability and reproducibility, so it doesn't mean that you're doing anything wrong. You just have to keep doing it over and over again.
Sure.
And that there's a series of breathing maneuvers that you do. So
does this thing close on me eventually?
it does, but only for one of the breathing maneuvers, and that whole one takes about 5 to 7 minutes to do.
Okay.
So just temporarily. It does have a safety latch, so you're not trapped in there.
Okay.
You would be able to let yourself out, but I wouldn't abandon anyone in there anyway.
I know you wouldn't.
So.
You wouldn't abandon me, would
No,
you?
no,
Okay.
no.
All right. So most of it is done when I'm sitting like this and I'm not enclosed, but there's about 5 to 7 minutes when you do enclose
That's
someone.
correct.
Can you do that just so the folks can kind of see what that looks like?
Sure.
Yeah, just so they get a sense of that. It's coming at me. There we go. All right.
So the mouthpiece is on there, and
Yeah,
that's where you would have your mouth.
Right.
And this closes, and then you're going to hear the air.
I hear that. Yeah. I sound echoey when I'm talking right now, but yeah. And so this is completely sealed right now.
That's correct. And I can hear you, and you can hear me.
Oh, yeah, you sound like you're in a microphone. Yeah, that's pretty cool. Okay. All right. So this is that part that we do for that 5 to 7 minutes. Okay.
Yes.
And actually for the folks watching, I tend to be a little bit claustrophobic. And so I would just say that felt really comfortable because you can see out through the glass. You're right there. That felt really, not a problem at all. So that's good. That's even though you would think that you might feel a little bit, that worked out pretty good. So, okay.
Yeah, it's pretty spacious in there. It doesn't seem as small as what it looks like. So.
Yeah. And so there's just a series of tests that you put folks through. And is it mainly through that breathing apparatus?
That's correct. Okay. There's nose clips.
Okay.
Because we want to measure all of the air. So
Yeah.
we clip your nose so that there's no air coming out through your nose.
Okay.
And then here's a mouthpiece. You seal your lips around the mouthpiece.
Okay.
And then everything that you're breathing gets recorded onto the computer here, and then that information goes to the pulmonologist.
Right. And so when you're doing this test, the purpose of it is to, as Ashley kind of mentioned, the big diagnoses are emphysema, COPD, and asthma.
Correct.
That's
This is the
typically
gold
where you're
standard.
trying to, okay.
But it basically lets us know all kinds of things about your lungs: obstruction, restriction, airway resistance, lung volumes, gas diffusion.
Right.
Yeah, and for folks that maybe they've smoked for a long time,
Yes.
they may get given the diagnosis of COPD, but it's really not official.
Until this test is done, correct.
Yeah, so, we're more and more trying to, particularly when people are going down the path of needing oxygen or, some sort of other kind of treatments, this information, the numbers, the objective information can be really helpful in terms of making that very clear to the patients where they're at.
Correct. So it's not just for diagnosis, it also lets us know the level of severity if there is a diagnosis in the COPD.
Right.
And also, if I remember right, Ginger, part of this testing too is some people that have COPD, they have a component of, I don't know if asthma is the word, but they can respond to inhalers. Other people that do this test, it gives them an opportunity to say, well, you need some oxygen, but in terms of like really doing a lot, the inhaler's doing a whole lot for you, maybe not. Or maybe a different type of inhaler, the Spirivas of the world, if you will.
That's correct. This test will let us know. We do the test,
Yeah.
and then we give you an inhaler to use,
Right.
and then we wait at least 10, 15 minutes,
Yeah.
and then we do one portion of the test over again, and it lets us know if you've had a response to the inhaler.
Yeah, like a bronchodilator
Yes,
challenge is the fancy
bronchodilator.
wording of that. Right?
Correct.
Okay. Hey, so Ginger, I wanted to ask you something about like other maybe types of patients that might come in here. So do you, on occasion, will you have heart patients that come in here?
Yes, we will.
Okay, what would they come in here and be part of the pulmonary function testing for?
Well, because the heart and lungs work together, and sometimes the test is being done to rule out a respiratory issue, to pinpoint either way.
Yeah. So
Or sometimes they have both.
Right.
They have heart disease and lung disease.
Yeah.
And I was just from my experience, sometimes it's hard to tease out how much of a person's shortness of breath is related to their heart, let's say heart failure, and their lungs if they have some lung issues, or you think they might have some lung issues. So a test like this can be really, I'm sure it can help to at least pin that down and begin to kind of
Correct.
narrow down how much of it is.
The lungs.
Yeah.
Yeah, exactly. And the other thing I just was curious about, do you see patients that have neurological issues? Because that strikes me as something that maybe you might see as well.
Yes, I've seen patients that have ALS or Lou Gehrig's disease, which can affect the muscles of breathing.
Yeah.
And so with this test, we can measure their muscle strength.
Okay. And is it one of those things that you'll every a certain period of time you'll do that to see if they've deteriorated, or is it just like a one-time thing with those patients just to get a sense of where they're at?
Yeah, we can do them periodically.
Okay. What do they do with that information? Do you know?
They determine the treatment for the patient.
Okay.
Sometimes it's a change of medication.
Okay, got it. All right. And I'm trying to think if there are any other patient types that you might see here beyond COPD, asthma, heart, and neurological kind of folks.
Patients that have allergies.
Okay.
Patients that are having cancer treatments that may affect their lungs.
Okay, so do you do pre-treatment and then after they've had the treatment for those folks, or do you just...
Correct, and we'll do them often to monitor their lungs.
So if they're getting certain types of... Is it mainly chemo, or is it the radiation side of things? Okay.
It's chemo.
Okay.
And also patients that are on long-term med use for cardiac issues.
Yeah, good.
Okay, well, hopefully if folks are listening, that'll give them just some more information about Even though this isn't a real big room, there are a lot of different things that bring patients to have this testing done. So I wanted you to be aware of that, because you never know when you or someone you know that you love might be part of being in this room sometime. So, well, hey, Ginger, it's been really helpful for me just to kind of see this whole process and how you do that. And yeah, sounds like this is, if I'm a patient and I think I might have asthma, or I think I might have COPD, or I think I might have some combination, you're the person I want to see.
This is the test to do, correct?
All right. Well, thank you for your time. Thanks for showing us around.
You're welcome.
Appreciate it. And for those listening, watching, if you have one of those diagnoses and one of your friends or family do, you'll recognize Ginger when she shows up to say hi to you when you come to the hospital. So thanks.
You're welcome.
Okay, our field trip continues. Here's Ashley again. Hi, Ashley.
Hi, Dr. Bird.
Okay, so Ashley, you want to tell us a little bit about what this part of the field trip's going to entail and who's going to take us on the trip?
Yeah, so we're down in our pulmonary rehab department. Pulmonary rehab is an outpatient service that we offer here at CGH, where patients that have chronic lung disease can come in. They can get a whole lot of education with a little side of exercise in there. And the person that they're going to be seeing would be Danica. Danica is our pulmonary rehab coordinator.
All right, good. Yeah. So you can pass the baton to Danica. Oh, she has it now. We were saying yesterday, in some ways it looks like you put that in like shaving cream and kind of do that on your face with these microphones.
Like a blush.
Yeah, I don't do blush a whole lot, but if I were to, that would probably be what I would use, yeah. Okay, so Ashley, thanks for the introduction. Danica, should we enter your world?
Yeah.
Okay, all right. Let's go in and take a look at pulmonary rehab. After you. Yeah, so if you're probably seeing through us to outside, we're on the first floor here of the hospital on the southwest corner? Southeast corner.
East, yeah.
Yeah, southeast corner of the hospital. So yeah, it's a nice location, nice view if you're here in pulmonary rehab. So Danica, let's just talk first of all, who shows up here? What kind of folks would need to come to pulmonary rehab and see you?
Mostly patients with COPD. So you have to have a PFT to qualify.
Which is a pulmonary function test, that
Yes.
breathing test. Okay, yeah, go ahead.
And COPD is staged anywhere from mild to moderate. So an FEV1 of 80% or less, that starts at the moderate. And then there's severe and very severe. So moderate, severe, and very severe can qualify you for pulmonary function.
They show up here.
Yep.
Okay.
Mild doesn't count.
Yeah, that makes sense.
Yeah.
That makes sense. You gotta get worse before if you're okay.
Unfortunately.
Yeah, well, no, fortunately, at least they're mild, right?
Yeah.
So, okay, well, talk me through the process for someone who comes here. What are you going to have them do in general when they show up here for pulmonary rehab?
So from like the very first session,
Yeah.
we have you fill out a lot of paperwork.
Okay.
The very first session.
We'll move past the paperwork because
Okay,
people
it's a lot of
people are like, I don't do paperwork. Okay, after they're done with the paperwork.
Sorry if I made that sound bad. It's not that much paperwork. Just a lot of surveys.
Yeah.
So you fill out all your surveys and you have to sign consent forms to exercise. Sure. And so then you're ready to exercise. Depending on if you have any like pain, if you have pain in your hips, we might not do the treadmill. We would maybe move over to the new step. It's a little bit more comfortable. Yeah. Or if you're good at, walking, but you get short of breath quickly, then a treadmill would seem appropriate. Yeah. And then you can do multiple ones too. We could work on weights. You could do treadmill and the new step, split it up. Usually it's exercise for about half an hour to 45 minutes.
Okay.
We have the arm crank over here and a recumbent bike.
Right. And I think Dana will probably pan out over the area just to kind of so folks can kind of see what we're talking about. So yeah, I guess what I'm going with that is like for folks who are, let's say they have moderate COPD, they're not going to be able to exercise at the same level that someone who has normal lungs. Sure. How do you figure out how hard to go that first time and then subsequent times?
We monitor their oxygen levels and their heart rate. So we always come up with a target heart rate.
Okay.
So you don't really want to exceed that target heart rate. And then SpO2 oxygen saturations, you want to keep at 88% or above.
Okay.
If they drop below 88%, we would have to put some oxygen on them.
Sure.
It's just a matter of, exercising them to those limitations if they exist and not overdoing it.
Yeah.
And then progressively, they should be able to build up endurance. And
Sure.
then with the 36 sessions over 12 weeks, hopefully by the end of those 12 weeks, they'll be able to show some improvement.
Yes. So I was going to ask you that. So this whole process, if everything goes the way it's supposed to, is about 3 months,
Yes.
3 times a week.
Yes. So for phase 2, it is Monday, Wednesday, Friday for 1 hour.
Okay.
And it's typically 36 sessions. It can vary by insurances,
Sure.
but average is about 36 sessions, which
Okay.
comes out to about 12 weeks.
And Danica, I remember you saying before we went on camera that phase 1 is like hospitalization.
Yes.
Can you start this if you haven't been hospitalized, or do you have to be hospitalized to come to cardiac?
No,
Pulmonary rehab, excuse me.
you don't have to be hospitalized. You would just have to talk to your doctor if it's something you're interested in.
Okay.
Make an appointment or even call your doctor and be like, hey, do you think I could benefit from pulmonary rehab? And then
Okay.
your doctor could tell you more about it. And then they could always call me too. I got a phone number and extension, email.
Yeah, we'll give everybody Danica's cell phone, and everything. No, I'm just kidding.
Work-related stuff.
No, but what I would say about that though is if someone is watching this or they know someone who might be a candidate for this, it sounds like the first step in the process though is to call your primary doc, and then you're going to have this pulmonary function test done, because we need numbers to be objective about whether or not whether it fits or not, and whether insurance will pay for it and those type of things.
Yep.
So let's say you've gone through phase 2, and I'm just curious. Have you had patients that came here on oxygen, and by the time they're done with their treatment, that they're off of it? Or tell me about some successes, or what would be a reasonable, someone comes here, what they can expect if they have a successful phase 2, 3 months
Sure.
with you, Danica.
So historically, we have had patients that have been able to be weaned down on their oxygen.
Yeah.
And I actually have a patient now who has increased their speed and their incline on the treadmill, so that we do see improvements overall.
Yeah, I don't know if you've seen this, but like I know from when I've had patients, I did when I remember, for some reason it still sticks with me, the patient's name in residency, and he came in really sick with his COPD, and between the inhalers that he was using and the treatments and going to pulmonary rehab, he actually did get off oxygen.
Yeah?
Yeah, so it happens. I hear though that part of pulmonary rehab may be, your oxygen level that you need to use goes down, but they feel better too.
Mm-hmm. Oh yeah, definitely. If you put the time and effort into it, almost everybody, ends up feeling better. Like I said, even that one patient, but most of my patients, all of my patients actually are showing improvements, and they can increase the time they're on a machine, and their resistance or like the incline on the treadmill is slowly getting better and more, and they're feeling less short of breath. I like to say, do you remember the first day that you were here? Do you think you could do this on the first day? Because, some people do get discouraged, and, there is bad days, but I just have them try to think back to that first day and see the overall improvements.
Yeah, I would think some folks also would just say like, when I started this, I had to stop on my way out to the mailbox, and now I can walk out to the mailbox and back, and
And not feel short of breath.
Yeah.
It's not a cure for COPD, which is kind of a lot of people think that it might be a cure. It's more of an improvement of your quality of life. There's not really a cure for COPD, but if you do pulmonary rehab along with correct medication usage and a healthy diet, there's definitely room for quality improvement of just life in general. Like you could, like you said, walk out to the mailbox and not feel as short of breath, or even just washing your hair takes so much energy. And
not for me.
No.
No, not so much, but I hear you.
Oh gosh, mine. Yeah, yeah. I don't even have COPD. But yeah, just overall, it just.
How do you wash your hair if it's that hard? No, I'm just kidding.
So just overall, pulmonary rehab helps to increase your endurance, your energy level. Just overall, like you can maybe start going for walks around the block and just live a little bit better quality of life.
Sure, sounds good. We were talking, also I see we have some speakers here at, and there now, patients, what is it for what?
We like their music. Mostly we like to listen to 80s music down here.
80s music.
80s music, yeah.
Hip hop? Hip hop?
No, hip hop.
Gosh, I would think that'd be a big hit.
I know.
Yeah, okay.
Just some upbeat little, I'm trying to think of an 80s song, I can't think. Just
Madonna.
exactly. Yeah, Madonna was on the other day.
I know the 80s. Okay.
And then I like to play HGTV down here. It's a nice background channel. You know, not everybody likes music, but HGTV seems pretty popular with my patient group in 80s music.
What? Okay, all right. Do you guys do any dancing?
No, I don't dance.
When the patients aren't here, do you do any dancing?
No.
Oh, okay, all right.
I don't dance. I can try, but it's not pretty.
I want to talk about one other thing in another spot over here. So let's walk over this way, and so Dana's going to kind of show us we're walking. This is for when more recumbent type of bikes and stuff like that. But here's the weight stuff that I know that Danica uses sometimes. But this right here, would you kind of talk about this pursed lip breathing and what that entails, Danica?
Yeah.
And how you work with patients on that?
Definitely. Pursed lip breathing is probably the most important educational aspect that we teach down here. So I'm going to try not to get too scientific, but
Yeah, go ahead.
so when you start to get anxious or when you're exercising and you feel like you just can't breathe and you have COPD, it's because your airways are typically rigid in a healthy person. And with COPD, your airways lose that rigidity and they're more so floppy, not completely floppy. But when you're breathing really hard and really fast, your airways close and it traps some of that exhalation in your lungs and you can't exhale all the way.
Yeah.
And you're inhaling before you can exhale, making you feel like you're...
Your CO2, your carbon dioxide level builds up,
can
which
over
makes you
time,
feel
yeah.
poorly when right.
Yeah.
Okay.
So this pursed lip breathing, we encourage to inhale through your nose for 2 seconds. And then if you exhale through your mouth through pursed lips, like you're blowing out a candle, for 4 seconds. So in for 2, out for 4 through pursed lips. That creates a back pressure that allows that trapped air to come out so you can get more air in.
Yeah.
I think for folks watching, I just wanted to make sure that we had an opportunity for Danica to talk about that, because whether you come to pulmonary rehab or not, if you have COPD or you know someone who has that, just even Google it, that kind of breathing can be pretty helpful.
Yeah, like I said, one of the most important aspects that we teach down here.
Yeah, particularly if you're having like a bad day.
Yeah.
You know, it can really kind of get you through a little bit. So, Danica, anything else that I forgot to chat with you about that you wanted to make sure that we talked about?
I don't think so.
Okay, it's been good. I know we do good work. I know you do good work down here. It's really a nice setup. Like I said, it's
It's a good view.
yeah. I mean, it has a good vibe to it here. And so anyhow, if you're someone who's struggling with your breathing, and you know you have COPD or think you might have COPD, talk to your doctor, get that process going.
Yeah.
And on the other end of that is Danica to help you out. So keep that in mind. Danica, thanks a lot.
Not a problem. Can I get my work phone number in case they want to call me? I mean, call your doctor, but
Yeah, go ahead. Fire away.
you can call me and I'll call your doctor.
All right.
It's 815-564-4847.
Say that one more time and slower.
815-564-4847.
Thanks, Danica.
You're welcome.